Good morning. I'd like to call the Health Services Committee meeting to order for the month of April. And the first thing we need is a motion to approve the minutes of the prior meeting.
I'll move it.
All right, Supervisor Strauss, seconded by Supervisor Conover. Any additions or corrections to the minutes? All right, all those in favor?
Aye.
Aye.
Opposed? Abstain? Carried. Thank you. All right, Dee, we'll move right on to you with the action agenda. Lengthy today.
And then can you pull the mic closer to you there?
How's that?
That's better. Thank you.
All right, Dee, are you there?
Can you hear me?
Yes, you can.
Okay, sorry about that. So I apologize. I was hoping to have a short agenda, and then I had some items added on last minute. First item on the agenda is permission to submit our 21-22 annual implementation plan to NYSOFA. This is basically just our annual update on how we're going to spend our funds and the number of units of service that we plan to provide under each individual program.
All right, someone like to make that motion to approve that? Supervisor Strauss, second. Supervisor McDevitt?
Yes, I'll second it. Thank you.
Thank you. All right, any discussion on that? All right, not then all those in favor?
Aye.
Opposed? Abstain? All right, thank you, carried. We'll go on to the next one, Dee.
Next item is permission to amend our ISIP contract with the Hamilton County Department of Social Services to remove the language where it states that we will pay them $1,922 monthly because we basically reimburse for salary and fringe for the month, and sometimes this goes over that amount.
All right, thank you. Would someone like to make a motion to approve that?
I'll move it, and this is Peter.
Thank you, Peter. A second to that. Supervisor Conover. Any discussion on that? All right, if not, then we'll vote. All those in favor?
Aye.
Aye.
All right, opposed? Abstain? All right, thank you, carried.
The next item is to enter into a contract with Mom's Meals to provide meals to seniors at a cost of $7.49 a meal, not to exceed $5,000. And this is in the event that we're not able to provide meals for any one of our sites on a temporary basis.
All right, thank you. Would someone like to bring that to the floor, please? Supervisor Conover, seconded by Supervisor Stroud. Any discussion on that? Or any questions?
Chairwoman, it's Andrea. I have a question.
Yes, go ahead, please, Ms. Hogan.
Can you outline for us occasions when this might happen, please?
So for instance, right now we have 2 positions that are open at our Cedars meal site, and we're having a hard time filling them with subs. So we might at some point use the Mom's Meals just to cover 1 or 2 routes temporarily until we can get those positions filled. Or for instance, when the pandemic hit, if a meal site had to close down temporarily due to individuals having COVID, it would allow us to provide the individuals on that route with the frozen meals temporarily until the site opened back up. So it's just a temporary thing. It's not anything meant to be permanent.
Quick follow-up.
Go ahead.
What do we normally pay for a meal?
It varies based on each site. So let's see. So for Chestertown, and we don't have the breakdown for 2020 yet, but for Chestertown it was $8.80 per meal. For Cedars it was $6.99 per meal. Indian Lake, which is Hamilton County, it was $11.50 per meal. Johnsburg, it was $9.01 per meal. Lake Luzerne was $6.40 per meal. So it just varies based on the site and how many meals we produce at each site, and then all the costs associated with it.
Thank you.
Any other questions? All right, let's vote on that then. All those in favor?
Aye.
Okay, opposed? Abstain? All right, thank you. Carried.
Okay. The next item, our food service manager at the Cedars meal site resigned back in March. We are requesting to delete this position and to create a meal site manager position. This is going to be similar to how we have it at all of the other meal sites, where basically the supervisory duties are done here at the office instead of having somebody at that site take over it or have somebody at the site do that. We just feel that it has not worked at Cedars meal site the way that it has been doing or way that it has been happening. So we just like to make that change. It'll be a small cost savings, but we just feel that it'll work better overall.
All right, thank you. Who would like to bring that to the floor?
I'll move it, Edna. This is Peter.
Thank you, Mr. McDevitt. A second to that motion, please.
I'll second.
Thank you, Mr. Conover. Any discussion or any questions? All right, then let's vote on that. All those in favor?
Aye.
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 Opposed? Abstain? All right, carried. Thank you. All right,
Okay. So the next,
Go
sorry,
ahead.
the next item, we have a position open here at the office. It's an aging services specialist position, which is a grade 10. We would like to delete this and create a position that is in between the grade 10 specialist position and an aging services assistant position, which is a grade 4. We are working with civil service and HR to figure out the duties and the actual grade that we want to set this as. Along with that, we would also like to change the aging services assistant part-time position to this position, and then the supervisor of volunteers position to this position as well. So basically, we would be deleting 3 positions and then creating 3 new positions. Unfortunately, we don't have the actual grade figured out yet, so we don't know what the grade will be or the amount or the title. But I wanted to bring it to your attention because it is something that we will work on and be doing probably out of committee, because we are hoping to have it done because this position was vacated the middle of March, and we've been working on it since then, and we just don't want to leave it until the next committee meeting because we feel that'll be too long. So I just wanted to make you aware of that so you knew what was going on.
But then we're not going to make any motion on this one then?
You want to do a referral to the personnel committee and have personnel discuss this and make a decision?
I believe so, if that's what we need to do.
All right, then do I need a motion for that? Someone to make that motion to refer it on to? All right, would someone like to make that motion for me, please? Supervisor Conover, second to that motion.
Second.
Supervisor Strout, now any discussion? Or we,
Just-
yes, Supervisor Conover.
Yeah, I just want to make sure that the movement of personnel is also timely in terms of what Dee needs to accomplish. Has anybody checked the calendar on that?
I mean, as to when the personnel meeting is that what? you're
Right. I mean, the reason we're not dealing with it today is that there's certain information Dee doesn't have. I just want to make sure the timing on that next committee meeting meets the program. If it doesn't, then we need to
April
I think we have 10 days.
Right,
10 days. Is 10 days, Madam Chairwoman, if we could ask Dee, may I ask Dee if 10 days is sufficient?
Certainly. Dee?
I hope so. Roseanne and I have a meeting with Trish tomorrow morning to iron out everything, so hopefully we can get the duties set so then it can go to Jackie so that Jackie and Trish can figure out the grade and the salary.
Sounds good. Thank you. All right, all those in favor?
Aye.
Abstain? All right, carried. Thank you. All right, D, number 6.
Okay, number 6, we had a contract in place with the Glens Falls Hospital Medical Alert for our PERS services, which is the Personal Emergency Response System. Last year I brought it to committee because they were going to subcontract with Connect America. This year they have decided not to do it at all, so we need to enter into a contract with Connect America to provide that service underneath the 2 contracts that we have for ISIP and then CSE. So everything should remain exactly the same. It'll just be a new person that we're contracting with. So everything will stay the same for our clients and there'll be no disruption in service.
Okay, good. All right, would someone like to bring that to the floor, please?
I'll move it, Edna. Peter?
Thank you, Mr. McDevitt. A second to that motion.
I'll second.
All right, thank you, Ms. Hogan. Any discussion or any questions? All right, then we'll vote on that. All those in favor?
Aye.
Aye.
Okay, opposed? Abstain? All right, carried. Thank you. All right, Dee, we'll move on to 7.
All right, so the last item on the action agenda, this morning we were notified that our food service helper at the Cedars Mill site was going to be resigning. Unfortunately, she's been out with some medical issues and she's just not able to return. So we are asking to fill this position exactly how it is. There will be some cost savings because she was hired back in 2006. I don't have the exact amount of what we'll be saving, but we would like to request to fill this position.
All right, then would someone like to make that motion to bring that to the floor, please? Supervisor Conover, second by,
I'll second.
I'll second it, Edna.
okay, Supervisor Hogan got there ahead of you, Peter. All right, any discussion on that?
I
All right.
just have a question, Edna.
Yes, go ahead.
Yeah, just a question relative to the, you might describe it as the emotional level of the population at the Cedars. I know for a while we did have some emotion expressed relative to the services provided. Is the situation under control? I guess that's my question.
Dee, we'll let you answer that.
As far as with the staffing or with the Cedars residents themselves or the clients that we serve?
What I would say that the staffing as it relates to the population of the residents, have things calmed down? I guess that's my question.
As far as the residents at Cedars, I think they've been happy with the services they've been receiving. As far as the clients on the Glens Falls, the Queensberry routes themselves, I think they've been happy as well. We haven't been hearing any complaints. Of course, everything has changed during the pandemic. So I think pretty much everybody's just happy they're getting the food at this point. As far as the staff, that continues to be an issue, but I don't want to go into great detail on a public forum about that.
Okay. Thank you very much. I appreciate that, Dee. Yep.
Okay, good. The question was answered then, Peter.
Thank you.
All right, let's vote on that then. All those in favor?
Aye.
Aye.
Opposed? Abstain? All right, carried. Thank you. All right, Dee, we'll move on to discussion items.
Yep. So the last thing I just wanted to talk about was, as many of you are aware, we were helping our seniors in both Warren and Hamilton County register for the vaccine clinics. And we were having some difficulty in Warren County initially because it was just the pharmacies that were able to get the vaccine for our seniors. Kinney Drugs was able to work with New York State to get kind of sole access to the Pfizer vaccine. And then work with the different Office for the Aging in the area that had their local drugstores to coordinate huge vaccine clinics. So we were one of the first Office for the Aging that got the doses. And on Saturday, March 13th, we held an 1,100 dose clinic for our seniors in Warren County. We did also open it up to Washington County residents and some Saratoga County residents and Hamilton County as well. But we just wanted to thank Kinney Drug Stores for being able to do that with us, to thank SUNY Adirondack for allowing us to host the clinics at their site, to especially thank Warren County Public Health and Janelle Jones and her staff for helping us secure that location, coordinate the clinic, and then also provide medical support on the day of the clinics. SAIL, Caregiver Support Initiative, the Herzog Law Firm, Conkling Center, RSVP of Warren and Washington County, the Sheriff's Office, public health employees, and then various volunteers that we had for helping us register all of these seniors that day, or the week up to that day. The Kiwanis Club, the Boy Scouts, Supervisor Driscoll and his family, and then SUNY Adirondack for helping us provide traffic control and parking assistance the days of the clinic. The Sheriff's Office for helping us use their signs to direct individuals as to where to enter. Dr. Leach for providing medical support the day of the first clinic. SAIL for allowing us to use their wheelchairs. Mike Colvin for helping us set up that COVID sign-up link, which was very, very helpful. Washington County Office for the Aging for helping us register clients and helping us out on the day of the clinic. And then I especially want to thank my Office for the Aging staff for all of their dedication and hard work since mid-January when these vaccination clinics opened up and we started our wait list. They've put in hours and hours, long days, and a lot of hard work signing up our seniors. And I would like to say that we are down to maybe 10 seniors on our wait list that have not been vaccinated, but overall we have helped 5,000 seniors in Warren and Hamilton County get their first dose of, and if not their first dose, their second dose of the vaccine, which I think is phenomenal. So I just wanted to let you know that, and that, you know, it's been some great teamwork in Warren County and Hamilton County, and I've seen some tremendous efforts from our entire community here in Warren County, and I just think that's amazing.
Well, I want to say thank you. That was a wonderful report. It was terrific the way you tried to thank everyone. And it has been a team effort, and we certainly do thank you, Dee, for all that you've done too. I know you've gone above and beyond. All right, anything else, Dee?
No, that's it for us.
All right, thank you. Any committee member have any comments that they'd like to make?
So,
Yes, Mr. Connell.
thank you. Thank you, Madam Chairwoman. I just want to say that, Dee, I haven't heard any major issues throughout the virus period relative to your department and the operations of your department. I can't even imagine the kind of strain that you and the folks in your department must have been under, given the senior citizen community that you primarily deal with. And I just want to say that, you know, that I think that all of us are much appreciative of everything that you've done throughout this entire period. Thank you.
There's no doubt about it. Thank you, Ron, for those remarks. All right, Mr. Lehman, do you have anything for us as far as public comment?
Hi, Chairwoman Frazier. No, there's no public comment right now.
Okay, thank you very much. All right, thank you very much again, Dee, and we'll see you next month then.
Thank you.
You're welcome. Okay, good morning, Janelle. You're there, I understand.
Yes, I am. Good morning. Ton and I are here.
Okay, I'm going to turn it over to you.
All right, thank you. So our first resolution request is to amend the Health Services Table of Organization in 2021 salary schedule to delete the Early Intervention Service Coordinator #2 position, which is $28,585, which is a 20-hour per week position, and the Early Intervention Service Coordination part-time #3 position, which is $29,577 for 24 hours a week, to create the Early Intervention Service Coordinator position, which is a grade 18 with an annual salary of $46,492, which is full-time status. This is referenced on attachment #1. Due to the retirement of a part-time service coordinator, Health Services would like to eliminate 2 part-time positions, create a full-time position to cover the anticipated caseload. The anticipated estimated savings in salaries and fringe is $12,562. The position is revenue generating, as Health Services can bill for service coordination, which is reimbursed by New York State at a rate of 49%.
All right, would someone like to bring that motion to the floor then?
Can I bring 1 and 2 together?
All right, what do we have for #2? Oh, to fill the Early Intervention Service Coordinator? I think that would be all right, wouldn't it? Yes, we can do that, Supervisor. All right, are you making that motion then, Supervisor Hogan?
I am.
All right, and would someone like to second that motion?
I'll second it, Edna.
Okay, thank you, Mr. McDevitt. Any discussion, any questions? All right, then all those in favor?
Aye.
Aye.
Opposed? Abstain? All right, carried. Thank you very much. We'll move on then to Janelle to #3.
All right, thank you. For #3, I'm going to turn the floor over to Ton Driscoll. Our resolution request is to transfer funds in 2021, and it's attachment #3.
In in this request, we're asking to just move $20,000 out of our full-time salary into our part-time salary, which is where it's budgeted full-time for a nurse we were hoping for. And unfortunately, we didn't fill that position in the beginning of the year, but we do now have a nurse that's available, just available right now on a per diem part-time, I guess, more basis. So I want to make sure I move money over to cover the salary we've already utilized going forward, going from January actually and going forward a little bit.
All right, fine. Would someone like to make that motion then for that transfer?
will.
Supervisor Conover, second by Supervisor Stroud. Any discussion on that? All right, then all those in favor?
Aye.
Aye.
Opposed? Abstain? All right, carried. Thank you.
All right, moving along for information for discussion and review. Again, I'll turn the floor over to Ton for a report of revenues and expenditures of 2021 and a comparison report.
Attachment number 4 are our financials as of April 7th is when we printed these. We have billed the 2 months for our home care, and we're in the process of closing the month of March. The other thing is to notice the salaries again. We are down in regular salaries due to positions that are still unfilled, but we do have overage from last year at this time. Obviously, it's all related to COVID. Between and this year, obviously, we started all the COVID clinics starting really the beginning of the year. So we've had to hire new nurses. We've had to utilize extra staff to get through the clinics, and that's reflected in both the part-time and the overtime categories. On attachment number 5, which again is comparing last year to this year at the same time, again, you'll see the salaries, nothing really much in the equipment line right now. But under contractual, again, that's due to timing of invoices. As it was when I had done this, there was already like close to $300,000 in a current batch that was going to get paid anyway. So I think it's starting to catch up now. We're finally getting those invoices in. They were a little delayed with some people getting them into us, but we've been working on them. So you'll see that difference in the revenue is just fluctuated by about 20,000 from last year to this year.
All right, thank you. Any questions on that? All right, Janelle?
All right, moving along, status of referrals and visits. You'll notice we are lagging behind on our referrals. However, in our visits, we're up over 101 from the previous year at this time. So I believe it's just contributed to kind of COVID crazy times. Our nurses continue to be very busy with the referrals that we do receive. Also attached is our emergency preparedness activity sheet and our rabies, activities, nothing too significant there to report. And just worth mentioning, we do have a staff member that's retiring. She came to us as a retiree, worked for us for 16 years, and she's saying goodbye at the end of the month. But Jackie Merritt, who's been working as an early intervention service coordinator, has done an amazing job. We're going to miss her. And I just wanted to give recognition for her time and effort that she spent with our department. And that's kind of what I have. Do you want me to go ahead to the COVID update, Supervisor Frazier?
We would appreciate that,
Okay, I'll be brief. I know you guys are running behind today. We don't have a lot of activity. I know I just reported to the board on Friday as well. This week, we're receiving 200 Moderna doses. In addition to doing the clinic for those, we're going to be doing 2 second dose clinics this week. For our Moderna clinics, we're going to be trying to target high-risk groups that don't have transportation, trying to do some pop-up clinics in different areas of the community where there's maybe higher risk people in certain housing. In addition, we're going to try to work with our WIC folks to see if we can do something with the WIC clients there. We had requested Pfizer. We went in with a couple other counties that I, had mentioned on Friday, and we found out over the weekend that we're not going to be getting that vaccine this week. We had hoped to be able to offer clinics to our high schoolers, 16 and older. I will say that Don Lehman made us aware of some spots available at the state site early Saturday morning. I quickly sent an email to all the school superintendents, in addition to SUNY Adirondack and SUNY Plattsburgh contacts, to try to get their populations made aware that there were appointments available there. So later that day, they were all filled. So I'm hoping it was Warren County people that them. But we're trying to still get creative in how we get our 16 and older population vaccinated. I do want to echo Dee's appreciation to the community. It's a great community to live in. I think everybody's working together very, very nicely. From the standpoint of all the work that we've been doing for COVID, whether it's Office of the Aging or the Sheriff's Department or different community groups. I know Town of Queensbury stepped up and offered us clinic space, as did a lot of other communities. SUNY Adirondack also, has helped us with some of our clinics in addition to their nursing students. The emergency squads have helped us in addition to Glens Falls Fire, but I do think everybody's working very well together as a community, and I just am appreciative of that. If anybody has any questions, I'm happy to entertain that.
All right. Well, we appreciate all that you've done too, Janelle. We know it's been a rough time for you for several months, and thank you. Do any committee members have anything they wish to ask or comments to make? All right, then if not, let's see if Mr. Lehman has anything for us. Nothing for us, Mr. Lehman?
Hi, sorry about that. No, there is no public comment right now.
Okay, that's fine. Thank you. All right, with that, then I'll entertain a motion to adjourn. Supervisor Conover, second by Supervisor
I'll second.
Stroud. All right, all those in favor?
Aye.
Thank you.
Aye.
This is your day. Thank you all. Thank you again, Janelle.